Hi, everyone. Welcome to this session on addressing environmental sustainability in the time of COVID-19. The COVID-19 pandemic has obviously transformed our way of life, from how we travel, how we study, to how we conduct business. As we continue to navigate the uncertainties of this global pandemic, how can we adapt our work to ensure we meet Philadelphia's sustainability and climate goals? My name is Akshay, and I'll be your moderator. Just a quick background, I'm an alumnus of the Clinton Global Initiative University and the co-founder and team lead of Nutrivide, an infant consumer products company that aims to address the global malnourishment problem via the distribution of low-cost, sustainable medical devices. I am extremely honored and thrilled to be joined by two champions of environmental sustainability. The first is Dr. Esther Chernak, who is an associate clinical professor and director of the Center for Public Health Readiness and Communication at Drexel University. I'm also joined by Ms. Randy Stipes, Chief Marketing Officer of IBM Watson Media and Weather. We'll be hearing from our speakers about the environmental crisis from the lens of COVID-19, followed by discussing ways to advance innovation and the extent of its impact during this time, which I think will be extremely valuable for our Codefest participants. I'm so excited to be with the both of you, and without any further ado, let's get started. So Dr. Chernak, this first one is for you. At a high level, as COVID-19 has spread across the planet, environmental disasters have placed additional stress on systems and countries that are already being stretched thin. In the past 2 months alone, we've been seeing shelters being set up for Hurricane Isaias, in which it may have been tough to socially distance, to California wildfires aggravating respiratory problems and increasing the risk of COVID-19. So my question is, what parallels exist between public health crises and environmental crises, and how can one impact the other?
It's a great question. When you think about it, environmental crises are public health crises. Crises in the quality of the water we drink or the air we breathe, wildfires, extreme weather events, they all result in morbidity, mortality, loss of property and economic losses, but huge impacts on human health. And so they're very, very similar in many ways. One of the biggest similarities is that both environmental crises and so-called public health crises like an infectious disease pandemic like COVID-19 have a disproportionate impact on disenfranchised communities and populations who have historically suffered severe consequences of crises, including extreme weather events, as well as COVID-19. We're talking communities of color, low-income communities, et cetera. So there's a fair amount of similarities. And I just would remind you, we think about the first EPA administrator under President Obama, Lisa Jackson, identified herself as a public health person. And in fact, she was one of the plenary speakers of the American Association of Public Health meetings that we have historically. And so I think environmental health has been a core discipline of public health for decades now. And I think it's important to recognize how the quality of our environment and environmental crises always ultimately end up impacting the health of the public.
Very well said, and I do think the two are inextricably intertwined, as you were mentioning. It's interesting, I think, how certain climate variables may be useful to predict periods of lower or higher intensity of COVID-19 and its spread in local communities. And I guess this is a nice segue into my next question with Randy. Since the start of the year, human activity has dropped dramatically across the globe. Millions of people are now working from home, dense urban areas have dispersed, and air travel has sharply declined. Could these changes in behavior have a significant impact on the trajectory of the climate crisis?
Well, Akshay, I think the short answer is no. I think a lot of people were hoping that would be some sort of silver lining coming out of the pandemic, but the emission reductions that we're seeing, and they are indeed decreasing, but the reductions that we're seeing as a result of people being at home, they're temporary. Lockdowns are not a sustainable solution. And the reality is that we're still seeing extreme weather events, that we've already talked about here today, that can be linked to global warming. I have been with the weather company, now in an IBM business, for the past 15 years. I can attest that this is one of the busiest hurricane seasons on record, and that's due to the warm sea surface temperatures. To put this in perspective, this last hurricane that made landfall, Hurricane Sally, a few weeks ago, Hurricane Sally was one of 5 tropical activities in the Atlantic at that time. Now, the last time that we had 5 concurrent activities was back in 1971. And then there's been reference to the wildfires that are sweeping the Western US, but whose effects can be felt all the way in Europe, which are being caused by hot, dry winds. And so, you know, I'd love to think that we were seeing a permanent reduction, but we have to look at the data. We have to look at the climatology, and we have to put our trust and base our action on science. And the science is simply telling us our planet is getting hotter faster.
Absolutely. And I do remember hearing former President Obama saying, you know, we're the first generation to feel the effect of climate change and the last generation who can do something about it. And I think you've done a great job showing the urgency here. And speaking about urgency, and Esther, I'll turn this over to you. Emergency preparedness is a key consideration for both natural disasters and infectious disease outbreaks. What lessons can be learned from the pandemic response in Philadelphia to inform the city's climate response?
Yeah, I think there's a couple of lessons that we've learned in Philadelphia. One, I think, would be how collective action is possible. You know, I think Philadelphia has done a nice job containing COVID transmission through limiting physical contact, through mask wearing, through shutting down, albeit with considerable pain from the perspective of economic losses and businesses, et cetera. But I think we've learned that collective action is possible. And I think you need that. We're going to need that for environmental disasters and to respond to the climate crisis in the same way that we've harnessed it for the shorter term response to the COVID-19 pandemic. And I think another huge lesson has just been the disproportionate impact on communities of color and high-risk communities within the city. And I think, you know, that's something that we've seen throughout history across the country and globe in terms of who suffers the impact of disasters disproportionately. And, you know, COVID-19 in Philadelphia, like the rest of the country, I think African-American and Hispanic communities have 3 times the rate of actually getting the disease, of hospitalization, of death. And I think in the same way, we see similar communities suffering disproportionately from environmental crises, disproportionately prone to living in areas that are subject to environmental crises and disasters. And I think certainly in a city like Philadelphia, but globally, we need to really focus on making sure that we mitigate risks in those communities and work on disease prevention and preparedness.
Yeah, I think you hit on a lot of the key points that I also noticed. The city government has done a tremendous job to bring about a crisis unit for COVID staff training and planning, from quarantine sites to surge hospitals to contact tracing, and all of that has been, you know, immensely, I guess, valuable to other cities as a model city itself. So, Randy, I'll turn this one over to you.
Sure.
In recent years, global companies have increasingly pledged to accelerate sustainability efforts. You know, for example, last year, the Philadelphia City Council established a goal of 100% clean, renewable energy by 2050 or sooner. My state of New Jersey is doing this as well. And this is a goal that many cities and municipalities should look up to. How is the pandemic impacting progress toward these very sustainability goals in the business sector?
Yeah, well, first of all, I applaud Philadelphia and New Jersey. I hope that others will take similar action, because the pandemic should in no way inhibit our progress towards sustainability goals. And I want to just share an anecdote. This is something that we experienced firsthand at IBM when the pandemic hit. We have a program called Call for Code, a program that many people watching are familiar with or may have even participated in partnership with CGIU. A little bit of background, it started in 2018, and Call for Code really brings together the developer community to take on pressing societal issues and do so using technology, open source technology. And then the real beauty of the program is that it's more than a hackathon. The winning solutions are successfully deployed, they're field tested, and they go to the communities that need them most. Since this started in 2018, we've had over 400,000 developers participate across 179 countries. So it's an incredibly powerful platform. And I'm sharing this background because in February of this year, before the pandemic hit, if we can even remember back to a time when we weren't in quarantine, we announced that the 2020 Call for Code Global Challenge would focus on climate change. We really saw no greater cause than climate change to unite this powerful community. And then the pandemic hit, and recognizing the impact the developer community could have on addressing some of the impacts of the pandemic, things like remote learning and community cooperation, we decided ultimately to have a dual theme, because we did not want to minimize the importance of addressing climate change by completely focusing the challenge on COVID. We really felt that it was important to show that these are both issues. They're issues that impact our health, that impact our planet, and impact our survival. And I think the difference is COVID's more acute. It's more top of mind for many right now, for most right now, but that doesn't mean that climate change. So short answer is we cannot, I was going to say we cannot take our foot off the gas, but in climate change, we should take our foot off the gas. I should say we cannot afford not to continue our efforts to mitigate climate change.
Yeah, very well said. And I think that summarizes this section of our conversation very well, where, you know, it's important to focus on both at once, and you can't really look at one without looking at the other either. And I think this helps carry into our next topic as well, which is advancing innovation and collaboration to really solve these really important, really urgent issues. So for the first question, I'd like to ask this to the both of you. So we'll go with Dr. Chernak first, and then we'll go with you, Randy. The pandemic is a hugely disruptive force that is prompting us to rethink the basic fabric of our societies. What opportunities exist for systems to build back better and transition to more sustainable practices moving forward?
It's a good question. I mean, there's sort of a short-term answer and a long-term answer. I mean, I think the biggest innovation that we've seen as a consequence of COVID-19 is the adoption of telehealth, virtual visits, where people don't come into the medical office when they need to interact with the provider or physician. They can do it virtually over the telephone or via the web or through, you know, a video, and that's huge. It has been a short-term response that was almost universally adopted to keep people from having to come into the doctor's office, protect them from COVID, and that I think is going to be here to stay. I think we recognize that that's extremely useful, and we can absolutely change the way healthcare is provided, and that's going to be a lasting change. And we'll see the degree to which that's implemented longer term. I know in the healthcare system where I work, you know, during the height of disease transmission in Philadelphia, over 75–80% of our visits were done virtually, and that was up from 0, you know, just a month or two earlier. And I think, you know, we're going to reach a new equilibrium whereby some percentage, and I think we don't know what that's going to be, maybe it's 20%, maybe it's 40% of our visits going forward will be virtual, and it'll help, you know, relieve the crowding in our clinic system, but it'll also be potentially even help, you know, physician burnout. So I think that's a huge and lasting impact. And you know, I think the story about the degree to which health impacts and health outcomes are impacted, you know, remains to be told. I think the larger issues are issues related to things like health equity and access to health care and access to a strong public health system, and really addressing these larger health disparities that really need to be addressed on multiple levels. Everything from making sure we have universal access to health care in this country, which is important for dealing with environmental health emergencies as well as infectious disease emergencies like COVID, but also making sure we have just equity in general in terms of addressing the impacts of systemic racism, racism in the context of job opportunities, educational opportunities, income opportunities, all of which contribute to factors that predispose to poor health outcomes. And I would hope, as we think about the legacy of COVID, that we take advantage of this crisis and address those major issues in our country.
Yeah, and I think if we want to really build on this infrastructure and make sure that we're prepared in the future, and we don't consider these aspects that disproportionately affect other communities, especially communities of color, then we're pretty much setting ourselves for failure the next time something drastic comes along and severs every supply chain again. And Randy?
Yeah, I'm going to take a slightly different angle to this. I think that there's an elevated social consciousness that is coming out of the pandemic, out of the racial injustice that we are unfortunately witnessing. And companies have an opportunity and a responsibility to be very intentional. And I hope that that is not something fleeting. I think this is really a good time for enterprises in particular to review their sustainable practices and their commitments, because companies right now are grappling with really challenging questions and issues. Questions about how to return to work and put employee health and safety first, questions about how to take action against the social and racial injustice. And people are demanding real action in these areas, and that should extend to sustainability as well. So what I'm hopeful for as we look at how to rebuild and build back better is that I'm hopeful that it will yield a path where companies are more transparent about their sustainability practices, and then they make very public commitments on their plan to improve. I can share in our case with IBM, 38% of the global electricity IBM consumes comes from renewable sources. That's not enough. We've made a commitment to increase that to 55% by 2025, and we're encouraging other companies to do the same. So we know that at the enterprise level, we can affect massive change. And I think that when we talk about building back better and building back stronger, it's really time for companies to put their money where their mouth is.
Yeah, thank you for even sharing that professional instance where change is actually being pushed upon. And I'd like to stay on you, Randy, for this next question, which is, what are you seeing as some of the maybe other promising emerging technologies and innovations and data tools that can help solve the climate crisis as well?
Yeah, I love this question. I mean, that is the cornerstone of what we do at IBM, and certainly we're committed to using technology for good. When we look at specific technologies, certainly things like AI, blockchain, quantum computing, data science, and analytics, those are all, I would argue, those are all hugely promising. But I think what's most important is the need for open source technology. We need code, number one, that is free. Number two, that is open so that everyone can use it. They can use it, they can review, they can build upon and test and then customize for their needs. But we've got to equalize the playing field, and open source is what ensures that we can collaborate versus working in silos, and which we know often happens. And that type of collaboration is essential for addressing the climate crisis or any crisis for that matter.
Yeah, no, I think that's an extremely important message. And I want to now turn this over to Dr. Chernak to talk more about this at a city and state level. So my question is, how can city and state departments of public health engage more closely with sustainability initiatives and innovations to jointly tackle both public health and environmental crises? And feel free to use any examples from Philadelphia there.
Yeah, it's a great question. I think the key is for public health to be at the table in sustainability collaborations. And I know in Philadelphia, public health has had a big role, I think, in thinking through some planning. And I know in the public health department, the program that addresses emergency preparedness has actually thought long and hard about climate change and ways in which the department can think through a sustainability plan and think through the health impacts of climate change and work to redress them among communities. Again, it's the reminder that public health and environmental issues are aligned inextricably, and that, you know, the health consequences of environmental crises, of climate change, are critical, and they probably require multiple players to really redress them. Not just the medical community and public health community, but urban planners, technology companies, et cetera, just to make sure that the, you know, the consequences of climate change and environmental crises are addressed and thought through at the health level.
Yeah, absolutely. There's many stakeholders that are inextricably involved in this as well. And I think a lot of their guidance comes from our experts, our scientists. And so, Randy, I'd like to ask you this question. You know, with the coronavirus, we are once again seeing a lot of skepticism towards science. And as the CMO at IBM Watson Media and Weather, you spend a great deal of time figuring out how to use technology to tell stories. So how can we change our messaging around these issues to be more effective so that they are actually heard? And what role can technology play in tackling the misinformation that we're seeing?
Oof, I actually think there's about 4 questions there, Akshay. That's a really loaded one. But let me address the misinformation piece and how technology can help, because I think that is such a pervasive issue in our society right now. And I'll give you an example. At the onset of the pandemic, and arguably still today, you know, we saw people really struggling to make sense of the overwhelming amount of information about the virus. And a lot of that information, particularly in the early days, it was misinformation. One of the things that we felt a responsibility to do at IBM was use our Watson AI technology. I talked about AI a little bit earlier. Here's a practical example. And we created an informational hub on the Weather Channel app and on weather.com for people to access localized COVID-19 incident data. The thought process was, you're coming in, you're checking your weather, you're used to using this app for very localized information. And although weather wasn't the source, we were a really powerful distribution tool, given how many people come to us and rely on us and trust us. And because a lot of the data was coming from disparate sources, you know, gathering and extracting the relevant pieces in a timely fashion, that's really challenging, you know, as humans, for us to go out and scan all of the various news sources and create our own spreadsheets and do the tracking is a really arduous task. And so while, you know, we all want to and need to understand the global picture of what's going on, the reality is what's happening in our neighborhoods and in our cities is so crucial and is top of mind when it comes to a crisis. So what we did is we put Watson AI technology to work. Because Watson can quickly access and make sense of massive amounts and diverse amounts of data, not just raw data, but structured data like charts and PDFs and graphs, we were able to distill down relevant information from all of these disparate sources very quickly, you know, helping people better understand the outbreaks around them. And so I think it all goes back to when you talk about misinformation, you have to leverage science, you have to leverage the data in order to actually tell an accurate story. And then you have to make sure that you're sharing it in a way that is very transparent.
Yeah, no, really, the world is anxiously waiting for answers that we may not have. And a lot of what gets heard depends on not only how compelling it is to hear, but that the data is sound. So it's not only empathy, but expertise that, you know, matters in that equation. And I think where social media should have been an ally in spreading truthful communication about these processes, you know, it becomes clear that there are others who, you know, unfortunately know how to use it better. So I believe, you know, paying more attention to this will help spur not only the focus for how new ideas can be implemented, but I think summarizes the section well in saying also the deliberate focus on having a long-term impact that is largely achievable is only happening by connecting with communities as well as businesses alike. And then one last question for Esther in this section. As we continue to think about what our society might look like a year or two from now, is it possible that recovery efforts will favor organizations or health systems that are embracing more sustainable technologies?
It's hard to know. I mean, I think You know, in the context of healthcare, I think, as I said before, I think telehealth is really is probably going to be one of the biggest long, you know, far-reaching impacts of the pandemic. And I think that, you know, we will see healthcare organizations use that. I think everything really depends on reimbursements and the way in which we pay for healthcare in this country, and even public health. You talk about what, you know, who's going to be around 5 or 10 years from now. You know, many hospitals and healthcare systems, you know, really truncated their services during the height of the pandemic to limit transmission in their facilities and to also utilize their facilities more effectively for COVID patients. And their reimbursements dropped tremendously, and many of them are now in crisis because reimbursement and the funding of our healthcare system is so tied to services that are elective and not necessarily in the service of the pandemic. Telehealth alone doesn't reimburse as well as an in-person visit. And so there are going to have to be real changes in the way we pay for healthcare in this country, and also the way we pay for public health. As I listened to the conversation about the technologies in the private sector and the way they can be harnessed to provide legitimate, accurate information, I thought to myself, you know, there have been many local and state health departments, including as well as CDC at the federal level, that have done a great job generating up-to-date statistics around the incidence of COVID and the impact it's had in their communities. But public health agencies are strapped. I mean, we've had a grossly underfunded public health system in this country. And there, you know, what I'd like to see going forward is a correction in the way in which we fund and support public health in this country, so that all these health departments have access to the latest in technology to really share data that's current and accurate with all the bells and whistles that the private sector has available to them.
Yeah, and I think more and more on the healthcare systems and hospital side, you know, as we are approaching more and more on the value-based care side, we want to make sure that we integrate these efforts as well in the decision-making, in the guidelines that a lot of these practices do follow.
I want to just also add to the comment about information and social media. I think, you know, it's fascinating to see how social media has been used during the COVID pandemic to provide information. And it's really a double-edged sword. While it's been an avenue for maybe a lot of misinformation, and I think it's disappointing that we haven't seen algorithms develop more quickly and perhaps more accurately to screen out the misinformation, it's also been a source of transmitting tremendously up-to-date information. And so much of it depends on from whom you get the information, but the combination of, you know, there's a lot of phenomenal experts and scientists who are using Twitter and Instagram and Facebook, but particularly Twitter, to share the latest in research and epidemiology and basic science and in what's happening with vaccines and findings and data from vaccine trials. And information is getting out there faster than ever. And the whole rise of the preprint, you know, manuscripts that have yet to be peer reviewed but are out there for public consumption, with the caveats that it has yet to be peer reviewed. I mean, we've never had this quality and quantity of information available so quickly in an emergency. I mean, the challenge is that it's you know, countered by a fair amount of misinformation. And I think unless you have some background in the science, it's very, very hard to discern what to believe.
Yeah, no, I think this actually leads really well into our final question for both of you actually in this panel. So we'll begin with Randy, and then we'll conclude with you, Dr. Chernak. The pandemic has taught us that we can't rely on technology alone to save us. You know, we must also rely on individuals to make proactive decisions by wearing masks and social distancing on their own, you know, accord. So realistically, how much of the climate crisis can be solved with innovation, and how much of the response must center around collective behavioral change? And feel free to add any last takeaways as well.
Yeah, I mean, listen, all of the above. So the reality is that, you know, reports have shown that 70% of our global emissions, like I think this dates back to 1988, 70% come at the hand of 100 global companies. I mentioned, like, that's why IBM is taking action. That's why we're encouraging others to do the same. But that doesn't mean, that's not an excuse for us as individuals to sit idle and admire the problem and say that it's someone else's responsibility to fix it. And so I think it's a combination. Yes, we need to demand greater action and accountability from enterprises. But as individuals, I'd say the first thing that we have to do is exercise our right to vote, support candidates and policies that will drive the need for the systemic change that is the only opportunity we have to really change the trajectory. And then do your homework. And I love that so many people listening, like our next generation, I'm so encouraged by the fact that you do your homework. Invest in climate positive companies. Look at your own carbon footprint, what you eat, what you drive, what you buy. One of this year's Call for Code finalists, this was just announced. One of the finalists is a solution called Offship. It was created by a group of developers actually in Canada from Morgan Stanley. And I have to give a plug to this solution because I think it's a practical example of something we can all use. And what it is it's a browser plugin. And it's meant to educate consumers, all of us, about our online purchases and their impact on the environment. And it does this, the way it works is it provides an estimate of the carbon dioxide footprint of every single purchase that helps us consider whether or not we need that, maybe consider alternatives. Or we can also purchase and donate carbon offsets credits pretty seamlessly through this so that you're offsetting what you're buying. Scientists have said, like it's been clearly stated, it's no surprise, we've got to cut our fossil fuel emissions in half by 2030. That sounds like a long way away. It's 10 years. So short answer is I think we need to pull every possible lever that we have to change the trajectory for the better.
Okay. Thank you, Randy. And Dr. Chernak?
Yeah, I mean, I think when you think about COVID-19, for example, the kinds of things that are going to get us out of this are really a mix of old-fashioned, very basic kinds of interventions like staying away from other people, wearing a mask, limiting respiratory transmission, not, interventions that are not a whole lot different than what was recommended in 1918 during the Spanish influenza epidemic. On the other hand, we are seeing the benefits of high-quality modern healthcare with huge impact on morbidity and mortality, and we're going to hopefully have a vaccine in the coming year or two that may not be the panacea, but will make a big difference in terms of limiting transmission. And that's absolutely a technology intervention. And one of the interesting things about the vaccines that we're seeing being, being tested now for the COVID-19 is the variety of new platforms, different platforms, the accelerated manufacturing infrastructure that's happening while phase 3 trials are happening. So I do think if you look at COVID-19, the response to the pandemic is really a mix of old and new in terms of the way in which we mitigate risk and limit impact. And I think in terms of climate change, I think that technology is going to be the big answer. I think coming up with alternative forms of energy, alternative ways to use energy, conserve energy, thinking about ways in which industries that are now major sources of carbon emissions can alter that footprint, is important. So I think technology may be even more important in the context of climate change than in disease prevention.
Right, and thank you, Dr. Chernak, for that. A lot of great points were brought up: civic engagement, policy development, acceleration of infrastructure, and making sure that we're considering all the communities that could be affected both positively and negatively with these new innovations as well. So I know that all flew by really quickly, but that about wraps up our panel. Thank you so much, Dr. Chernak and Randy, for all the knowledge and insights today. Appreciate the time and dialogue, and good luck to the Codefest participants. Thanks again and Godspeed.
Pleasure.
Thank you. Good luck, everyone.
Take care.